Breast augmentation started out in the 60s but got popularized during the 80s with Pamela Anderson showing off her breast implants, which were round, high profile, and the 80s and 90s spoke about breast implants being more than larger in size. Over the few decades, people are now opting for smaller size implants. The hesitancy to do such a surgery still exists. Well, you could have someone coming and asking for a particular type of implant and someone looking a larger implant, someone looking for a smaller implant. So why the perfect shape looks different for everyone? Breast augmentation today is in the top 5 procedures done in India by the plastic surgeons also. Now, first comes your body proportions. Different body shapes and sizes require implants that complement the individual's natural curves. For example, a person who has a smaller frame may benefit from a smaller implant to achieve a harmonious look, while someone who has a larger frame, a broader chest, and who's tall may require a larger implant. When we choose your breast implant, we also do the measurements of your chest. So choosing the size of implant is directly related to your breast measurement. All individuals' lifestyle play a significant role in an implant choice. Now, active individuals, athletes, they prefer implants that are shaped and positioned differently to accommodate their physical activities and reduce their discomfort. If a person is non-athletic but is rather skinny, then a breast implant is chosen and positioned very differently. So we need to remember, breast augmentation was in general chosen for those women who are generally flat-chested. For those who have some amount of tissue in the breast, may not choose breast implant and also can opt for fat transfer. Talking about desired aesthetics, people have different aesthetic goals influenced by their body and personal style. Some may want a more natural look, and some may want a more fuller appearance. When we talk about fake breast implants, that's a wrong word to use because what is the meaning of fake? Well, it all depends on what you desire. If you are looking for a deeper cleavage, if you are looking for a more fuller appearance, then we have to go for a slightly oversized implants. But if you are looking for a very natural result, you are just looking at increasing your cup size by 1 or 2 sizes more and you want to make sure that no one knows that you have done an implant, then we select an implant exactly based on your breast measurements. Now, there are various kind of implants which are present in the market. We use low profile, high profile, moderate profile. We can choose the different profiles and projections of the implant based on what kind of cup size you want. Coming to the early 2000s and the present situation, it's all about new natural looks. There has been a twist in the story over the years about breast augmentation, and people do not these days like the unnaturally very large fake looking breasts, and they believe in their individuality and they believe they can choose a right size implants which makes them look natural and also natural with the rest of their body. Then comes about customization of this procedure. So breast augmentation was all about silicone implants, but over the last 2 decades there has been the evolution of fat grafting or fat transfer. So we choose the patient and decide whether they are a good candidate for fat grafting or they can choose a breast implant. Now, in India, fat grafting has become highly popular. In my practice over the last 15 years, there are more and more women coming and looking for fat transfer because there is still a lot of taboo about breast implants. But let me tell you, we have come to 4th generation breast implants which are highly safe, highly secure, have a warranty of 10 years and are extremely good to go as a medical grade 3 device. So you need not worry to have implants. Well, if you're still worried, you can choose fat transfer. But there are pros and cons to both these procedures. Breast implant is one of the shortest cosmetic procedure. You wouldn't imagine. It just takes me 30 minutes and I complete the procedure. You walk in and walk out the same day. It has a small scar which is usually hidden underneath the breast. Now, when we talk of fat grafting, the whole technique involves me removing fat from an area of the body, then processing the fat and injecting it into the breast. Now this is a more tedious process, hence the procedure takes about 2 to 3 hours, and we will be traumatizing another area of the body also. You will have a couple of weeks recovery in the area that we do liposuction to take out the fat and put it into the breast. The advantage of breast implants is that you can decide what cup size you want, and we measure your breast and we choose an implant which will exactly give you that cup size that you desire, and it is permanent and there are no changes required. There is one disadvantage with fat transfer, is that it is not as permanent as implants. Remember, whatever fat that we inject into the breast, in stage 1, there are chances that 30 to 40% or sometimes more of the fat gets absorbed into your body, and you may need to do a second and a third stage about 4 to 6 months apart. The idea behind breast enhancement is to customize your procedure. When you come and visit me, I will decide whether you are a candidate for breast implant or fat transfer. Now, there are many situations where we have to combine both the procedures. We have to do a silicone implant along with fat transfer. There are certain deformities in the breast called as a congenital tuberous deformity. In these deformities, it is not just about volumizing in the breast or giving enhancement or giving a cleavage. The woman also suffers from a change and an abnormality in the shape of the breast. So it is wrongly shaped, sometimes the breasts are asymmetric, and we need to not just correct the volume but provide a good round shape to the breast. So here where we combine reconstructive breast surgery along with aesthetic breast surgery. And your treatment will be customized. Sometimes we have to customize the fat transfer along with a breast augmentation. In many situations where someone does have a little bit of fat in the body and wants a very small size implant, we can place an implant, and to make sure that the implant is not very visible and they want a natural look, I add the fat on the topper part of the cleavage so that they get a smooth transition and you cannot see the borders of your implant. So are you ready to find the perfect shape and size for your breast? If you like to know more about breast augmentation, do visit our Instagram channel Dr. Dr. Karishma Kagod. If you like this video, press the like button below and subscribe to Dr. Karishma Aesthetics.